My name is Beth Glover. I do pediatric hematology, oncology, bone marrow transplant nursing, and I've been a nurse for 37 years. When people find out I'm a nurse, they're almost always excited about it, and then they want to share stories of encounters they've had with nurses, or how they wish they were a nurse, or happy moments with families that are nurses, and or maybe they are a nurse. They're almost always really high approval and thanks, gratitude. They just really like it. When people find out that I work in oncology, over the years I've learned to kind of steer away from telling people that initially, because almost all of them become either almost horrified and say, how can you do that? That's so sad. I could never do that. Or some of them reflect on family members or friends or their own situations in which they've had cancer scares or crisis in their family, and they're grateful for the nurses. But even amongst nurses, there's oftentimes a pulling back, and it changes the tone of the conversation. People get really emotional about that news. Well, I've thought about this for many years, because originally when I was a young nurse, I felt sort of ashamed, or like something was wrong with me because of my choice of career. But after I thought about it, I thought, well, if it were my family member or my friend or myself, I would want a really good nurse to take care of me or my family when they had cancer. And so I feel like it's something that I can do, and that I can help people restore their health or cope with their family crisis. And so I can do it, and I do it. And it's not always a sad thing. Sometimes it's sad, but over the years I've watched the cure rates skyrocket, and new treatments have been developed, and we've had many, many long-term survivors, people that do really well, and they come back and visit us. They're grateful. We've had a positive impact on so many lives. So it's a very gratifying career, and I'm glad that I do it. I have no regrets.